Streaming live. The leader in Internet talk radio. VoiceAmerica.com.
It's time to live the dream life that you were born to live. Welcome to The Most Selfish Woman in America, How to Make Your Dream Life Your Reality, with host Christy Sale. At this stage in your life, there should be nothing holding you back. We'll give you the tools and tips to fix what's broken in your life and help you make sure that history doesn't repeat itself. Now, here's the most selfish woman in America, Christy Sale.
Hello, everybody, and welcome to How to Make Your Dream Life Your Reality with me, Christy Sale, the most selfish woman in America. And my goal is to inspire, enlighten, and empower you to live the life of your dreams. Now, you cannot live the life of your dreams if you can't see it. But when you're taking that long look at yourself to figure out how you look in that dream, you might just be getting a little distracted by that person in the mirror that's looking back at you. I remember the day when I was walking by a mirror, stopped dead in my tracks, realized it was me, and looked behind me hoping that it was someone else. Really, I couldn't believe what I was seeing. Father Time had been marching across my face when I wasn't looking. It was scary. So, of course, the first thing that needed to be done was researching the possibilities for a face overhaul. But I didn't want to do anything severe, so I looked for the non-surgical procedures available, and that is what we're going to share with you today. Now, we are lucky enough to have Dr. Michael Gold with us. He is a board-certified dermatologist and dermatological surgeon. He's going to educate us on the different non-surgical procedures available to brighten, tighten, and repair your skin and hopefully get rid of all evidence of your unhappy past. Okay, maybe not all evidence, but make you look younger and more vibrant, and who wouldn't want that? We are lucky enough to have Dr. Michael Gold with us. He is a board-certified dermatologist and dermatological surgeon, and he's going to educate us on the different non-surgical procedures available to brighten, tighten, and repair our skin. So thank you, Dr. Gold, so much for being with us.
Thanks, Christy. It's my pleasure to be here.
Absolutely. Well, let me give everybody a little background on Dr. Gold. He is the founder and medical director of the Gold Skincare, Advanced Aesthetics Medical Spa, the Laser and Rejuvenation Center, and the Tennessee Clinical Research Center, and they're all located in Nashville, Tennessee. And he is actively involved in a combination of medical and surgical dermatology, cosmetic dermatology, aesthetic services, and research. And Dr. Gold is also in the development of new pharmaceutical products and medical devices. He is a busy guy. So, Dr. Gold, women our age are looking for ways of either doing damage control or just trying to slow down the aging process. But most of us aren't interested in surgery. So I want us to talk about the different procedures that are currently available, and then later we'll talk about the ones that are coming up in the future.
Sure.
But now you told me that this type of cosmetic and aesthetic dermatology covers everything from lasers to skin care to products. But I think we should start with the deeper treatments and then work our way toward the surface of the skin. So what exactly are energy-based sources?
Well, we use this term now called energy-based systems. Most people know them as lasers or light sources, but they're more encompassing than that in today's world. So we use lasers. We use things that are called intense pulse light devices, which are not lasers but light sources. And what we've done in the last few years is taking other energies, whether it be radio frequency or ultrasound, and we've used them and put them into medical devices that do a lot of wonderful things to people's skin to help reverse the damages that have been done to your skin and try to prevent newer problems from coming up later. So there are a variety of devices that we have now that help people skip the knife, if you will, for a long period of time. Many of our patients don't need to even think about having a surgical technique now in their 40s or 50s. You don't have to think that way. We have enough technology, what we call minimally invasive, non-invasive technologies that will make your skin look great, feel good, tighten your skin, make your wrinkles go away, get rid of some of the pigment damage, all those kind of things that maybe 10 years ago you would never have thought of unless you had a facelift, and full resurfacing of your skin. Now we can do with very little downtime, much safer, in doctor offices, again, making sure it's the right doctor doing these procedures. So we have a lot of options.
So does each source address like a different level of tissue? Is that why there's so many different options?
Yeah, it's that there are a myriad of problems, and now we have a myriad of solutions to handle those problems. So I think that when somebody comes to me and they say, I want you to fix my skin and I don't want surgery, the first question that I will say to somebody is, tell me what bothers you. Because not always the problem that bothers me, but bothers the patient or your listener is what I might be bothered by. So I always sort of ask the patients what bothers them and then start addressing the concerns and what I can fix. So we start with the skin level surface. Okay, what do you see on the skin as far as broken blood vessels or pigment changes? And then we start looking at, well, where are your lines and wrinkles? Where is the skin sagging? We focus a lot on eyes. We focus a lot on eyes, and we focus a lot on the mouth, because eyes give away a lot. You can tell a lot by a person, just whether they have those furrows between their eyes or crow's feet around the eyes. Do they have drooping of the eyelids? And then around the mouth, we look at wrinkles and big folds and fissures around the mouth. So we can address those problems. We look at your jowls, and do you have sagging skin? And then each one of these things can be targeted with different devices to make everything look better and feel better. So, I mean, we can walk you through these devices in broad senses. So we have the intense pulse light devices, which we call broadband light, which is just a light source which is put into a machine and sort of filters out the light that we don't want and filters the light that we want to attract energy to destroy blood vessels or to destroy pigment. And that works really well. Most people have heard this term photorejuvenation or photofacials. The machines that we have today are very sophisticated. They're actually much safer. I started with intense pulse light devices in the mid-90s, and our devices then were okay. They're much more sophisticated, much safer now, and that really addresses a great problem that people have, these pigment changes, these broken blood vessels.
Okay, wait. So let me go back to the deep tissue treatments are done with the lights.
The deep tissue treatments are done so somebody has sagging skin or they have deep wrinkles. The devices of today that we sort of think about are twofold. We talk about the term fractional therapy, sort of started by a company called Fraxel, which is the company is sold to medical. They make a device called Fraxel. There's a whole variety of fractionated devices now which are getting a lot of really good press. So if somebody comes to me and they have sagging skin around the eyes or on the jowls or on their neck, which is the deepest of the processes, I actually will start talking to them about a fractionated ultrasound. And the device is called Ulthera, and the treatment is called Ultherapy, where we use fractionated ultrasound to penetrate really the deepest that we can penetrate into the skin safely, which is like 4 millimeters under the skin, with bursts of ultrasound heat or energy that will basically reformulate the skin that far under the skin, and the resultant collagen formation tightens your skin. So ultherapy is used for skin tightening. It doesn't address any of the skin surface concerns. Then we have people that have deep lines and wrinkles.
Wait. Let's go back to the skin tightening.
Okay.
So I guess I just don't quite understand how light going through the tissues can lift and tighten the skin. I mean, if it's already, that seems like almost a muscle issue.
Well, the ultrasound's penetrating almost to the deepest part of the dermis, okay, which is very far down, just above the muscle. And so what we've learned from, again, you have to understand these things get studied in animals, and then they get studied in humans, and then they get FDA clearances. What we know by delivering ultrasound energy in a fractionated, which is these small little holes, we destroy that area of skin where the fractional energy takes place way down in the skin. It leaves everything else alone. And then it destroys that skin right there, and then the skin next to it, which is normal, we use its wound healing capabilities to heal the skin. And in this whole process, we're actually creating new collagen.
So what's happening is it's starting to build back up into those holes, which in turn lifts the skin up.
Lifts with new collagen, which is oriented the way it's supposed to be, and compared to what our skin looks like in our 40s and 50s, and it becomes much tighter.
Okay, so if it used to be called fractional, and now it used to be called
Fraxel was the first. Fraxel was the first term.
But
we call the whole thing
fractional.
fractional.
Oh, okay.
And fractional can be ultrasound, which is Ulthera. Fractional can be radio frequency, which also goes very deep in the skin. So there are a variety. The biggest one on the market now is a device called the E-Matrix, made by a company called Syneron. And E-Matrix uses what's called bipolar fractionated radio frequency, which means that I tell people to think of an upside down ice cream cone being put into your skin. So you have radio frequency, which is energy, heat, thermal energy that can destroy tissue. I can take that ice cream cone, and you have very little what we call epidermal, or the top layer of skin, damage. That's the top of the inverted ice cream cone. And then I can take the energy and take it in a almost, both sides going down wider, like the ice cream cone inversion, as deep as I want into the skin. So I can handle deep lines, deep wrinkles, and so forth. And that's where the technology is today.
Okay. Well, how often can you do procedures like this?
So let's take the two what we're talking about. So Ulthera, or Ultherapy, which is the fractionated ultrasound, is really a one-time treatment. It requires, because it goes very deep into the skin, it requires some pain control. It is not a pain-free procedure. It's done in offices without any issues. We give our patients a little bit of pain medicine while they're here. We monitor them very closely. And we do a procedure, and the tightening effect takes place over a period of time, anywhere from 6 weeks to 3 months. Our patients see the results of this tightening.
So that's what they can expect, but what are after procedure care? What's that?
Well, for Ulthera, there's really no after procedure care. The biggest thing that we tell our patients with Ulthera, and when we do this Ultherapy, they can't drive home that day because we're giving them medicines. Right. So I require somebody to actually take them home. But after they're home the next day, they're fine. There is no downtime. Everything is bypassing the top layers of skin, so everything that's happening is very deep into the skin, and so there is downtime with Ulthera. When we talk about fractionated radio frequency, again, depending on the depth of this inverted ice cream cone that I create under your skin, you will be red from anywhere from 2 to 4 hours to 2 days.
Okay.
And so patients need to understand that there's going to be some redness, and some maybe a little superficial crusting on the skin, but there by no means is there any downtime that you have to stay in bed, or you couldn't go out. You couldn't put a little makeup on to cover it with the E-Matrix.
Well, I was wondering if there was any type of oozing or,
not with the E-Matrix device. And so I like using that for a lot of my deeper scars or my deeper wrinkles. And so that's the kind of procedure where we do need several treatments, usually done about every 3 to 4 weeks, to get to the end result. Again, it's radiofrequency. It's a thermal injury pattern under the skin. But again, it makes wrinkles go away, and there is some degree of skin tightening associated with it as well as you develop this new collagen.
Well, then how do you know if it takes a while for you to see the results? How do you know when you've gotten there if you keep doing it every 3 to 4 weeks?
Oh, because we follow the patients, and I'll know some people after 1 or 2 treatments, I'm done. That it depends on how the wound response is under the skin. Mm-hmm. A lot of that has to do with genetics. Lots of that sometimes has to do with our skincare routines that we put our patients on. We use a lot of growth factors now in some of our medicines to post procedures. So we have some really good ways to monitor how they're doing, and patients see a difference. So with Ultherapy, with the tightening, you see the difference over time of skin tightening. With E-Matrix and some of the other fractional devices that exist, you see the difference, within 2 or 3 or 4 weeks. Sometimes you need another treatment because you need to get more improvement. Right. And again, that's something between the doctor, the patient. They'll make that decision, and it depends also on the fractional device that you use, because we have radiofrequency devices like E-Matrix, and of course, complicating it more, we have lasers, which are beams of light that cause fractional injuries, and we have 25 of them available in the United States, at least 25, and if you go to Europe and Asia, there's another 50 that all do fractional laser treatments. Some of them are what we call ablative, which means they create a hole, through hole of the skin, and they can penetrate as deep as I want them to go. The deeper I go, the more risks associated with the procedure. So you have to really know that the doctor knows what they're doing. Or they have what we call non-ablative, which are injuries under the skin, but very superficial for the most part. Okay. And they work over a series of time. So we have a whole group of these fractional devices, and I'm really just focusing on the 2 that I started with. Right. And there are others, again, in the laser family. So it's complicated, but...
Well, then let me ask you this. Does the fractional resurfacing address dark spots also, or it doesn't go across the surface of the skin, it just goes straight down?
Well, again, the concept of any non-ultrasound. Ultrasound doesn't address anything but deep down tightening. When you get into the fractionated lasers and the fractionated radiofrequency devices, there will be pigment improvement. They actually have FDA clearances, most of them, to treat things like melasma, which is this darkening of the skin with hormonal changes. They don't cure melasma, but they treat melasma. And many of the devices are focusing on pigment changes because that's one of the really crucial aspects of photoaging or damaged skin. In the United States, we think of wrinkles as the biggest part of photoaging. Well, the photoaging outside the U.S. or in skin of color, which is the predominant outside the U.S., Asia and so forth, they actually have more pigment abnormalities and pigment concerns as they age than we do here. So a lot of our energy in the laser business is focused on making wrinkles go away, tightening the skin, and dealing with pigment.
Okay, let me ask you this. What are the best ways of tightening the skin, say, on the neck and around the eyes? Is it safe to use laser around the eye area?
Oh, sure. Again, I think first of all, you have to make sure your doctor is a board-certified dermatologist, a board-certified plastic surgeon, facial plastic surgeon, oculoplastic surgeon. We call these the core specialties. We strongly believe that there are lots of people using these devices that shouldn't be using these devices.
But what is the best for the neck and eyes?
Well, again, it depends on where you are and what you want doing. If you come to me and you have a lot of sagging around your neck and eyes, and I'm going to push you to the fractionated ultrasound, in today's environment. Because to me, I can get there. I can get where you want the best is the best I can do.
The most effective.
It's the most effective. It's not inexpensive. Okay. So that's another part of the puzzle. Each one of these machines costs a different amount of money based on a lot of factors. And with the old therapy, there's actually a part that the physician actually has to buy. So they have to pass on that cost to the patient.
And the one that you only do one time obviously is going to be more than the ones that you repeat.
Right. So the old therapy, it runs, anywhere from, if somebody's doing just the neck or the eyes, they're going to probably charge between $2,000 and $3,000 a procedure. And if they combine do the neck and the eyes in one procedure, they'll probably be charging between, $3,500 and $5,000 depending on where you live.
But what is the most effective treatment for eyes that isn't surgery?
Well, there's a lot. I mean, you can do all therapy around the eyes. I do E-matrix around the eyes, and I do fractional lasers around the eyes every day. And they all work. Again, they're all different. Some people, so if you came to me, Christy, and said, look, I want the best thing you can do, but I can't have 1 minute of downtime. I have something for you in the form of a laser. It'll take 4 to 6 months of treatment once a month, and I will get you great results because I have that technology. If you said to me, Doc, I don't care if I spend the next week in bed, I have a treatment.
Fix it.
and I have a treatment for that. So it's non-surgery. It's laser. We call ablative, or we're actually, going through the skin, and you're going to be red, and you're not oozing, but you're red and uncomfortable. You're not uncomfortable physically, but it's uncomfortable looking for about 5 days. And during those 5 days, at least the first 2 or 3 days, most patients won't go out. So again, the first question I ask people on the eyes, if you said this is my problem, tell me your downtime capabilities. Because that then determines what I do.
And then, of course, you have to protect your skin from the sun, right?
Right. That's the most important. I mean, I turn people down to do procedures when I talk to them about their skincare routines. And if somebody says to me, look, I'm not going to be using a sunscreen. I don't use a sunscreen. I'm never going to use a sunscreen. I'm not your doctor. Because I don't need I spent my whole career trying to educate people on skin cancers, okay? And the number one cause of skin cancers is sun.
Right.
Second is tanning beds. And that's another issue. I don't want my patients in tanning beds. So we focus a lot on that, but if you're not going to use a skincare routine, and I don't care if you buy it from me or you buy it from somebody else, it has to be the right skincare routine, and it must have a sunscreen in there because we must protect. You're spending a lot of money.
It's like an investment.
Well, it is an investment, and if you don't take care of it post investment,
there's no point in doing it.
There is absolutely no point, and I don't want to be the one doing it for you to come back in 3 years and go, look, Doc, I spent all this money with you, and I'm where I was.
Or dare they not take care of it and then tell somebody else, oh yeah, he was my doctor, and they're like, I think you wasted your money.
Right, and we do, and obviously those people exist out there. If your listeners get on the internet, if you go onto a doc site and read a report, you don't find necessarily people that are the hundreds and hundreds of happy patients. It's the one unhappy patient or the one that didn't live up to you didn't live up to their expectation. So we have great fillers, we have great toxins, we use them together. And actually we use them with our energy-based devices. So, if somebody needs to have Ulthera and Botox, we can do that. If you want E-matrix and Botox, I can do that. So we do a lot of combination therapy, and that's really important too.
Dr. Gold, you have been a wealth of information. Thank you so, so much for being with us today.
Well, I thank you.
So you can access Dr. Michael Gold's practice, his services, and his office locations at goldskincare.com.